Gastric Bypass Surgery. Procedure. This procedure is also called as Roux-en-Y gastric bypass. It is the most commonly performed bariatric surgery worldwide. Using the stapler devices, surgeon divides a portion of the stomach to create a small pouch. Then the small bowel is divided, and the distal end of the divided bowel is brought up to be attached with the newly created stomach pouch. Finally, the other end of the divided small bowel is attached to the distal portion of the small bowel in Y-shaped configuration. Mechanism of losing weight. Liver produces bile which helps digestion of fat, and pancreas produces pancreatic juice containing various digestive enzymes. Normally, food from the stomach is mixed with bile and pancreatic juice at the duodenum. Then, the mixed contents flow into the small bowel, where nutrients are completely digested and absorbed. But, after the gastric bypass surgery, limited amount of food is digested in the small gastric pouch, restricting the quantity of ingested food. Then the ingested food gets mixed with digestive enzymes after significant portion of the small bowel has been bypassed, which result in decreased nutritional absorption. Additionally, this rerouting of food changes the level of intestinal hormone, and results in early satiety and suppressed hunger. Advantages and disadvantages. Gastric bypass is the most commonly practiced bariatric surgical procedure and very effective in long-term weight loss. However, this procedure is more complicated than the gastric band surgery or sleeve gastrectomy, as such, complication rate is slightly higher and hospital stay is little bit longer. This procedure may lead to dumping syndrome, which may contribute to weight loss. Normally, passage and appropriate digestion of food in the stomach is controlled by a muscle group known as pyloric valve. But, after the surgery, the stomach pouch is directly connected to a small bowel, and the undigested food rapidly moves into a small bowel, resulting in a physiologic reaction called dumping syndrome. Symptoms of dumping syndrome may include abdominal pain, nausea, palpitation, anxiety, cold sweating, diarrhea, etc. So, the patient must adhere to dietary recommendations to avoid dumping syndrome. Also, there is a risk of vitamin-mineral deficiency. So, long-term follow-up with dietary supplementation is required. Thank you.